I guess when I sit down.
When you hear the word diabetes, what comes to mind? For most people, it's sickness, a poor quality of life due to being sick all the time, painful shots, or the daunting daily task of always checking your blood levels. All of this sounds scary and very tiresome, so it's understandable why the diagnosis of diabetes would be hard to take. But you should know that millions of Americans suffer with this disease every day, but they all go on to lead healthy, long, and fulfilling lives. I experienced this painful and scary feeling about 2 years ago when my sister was diagnosed with type 1 diabetes. She was scared, we were all scared for her, but now I've seen her grow from everything she's learned about the disease and how to take care of herself and the changes that she's made in her life. And she's already planning to have kids next year, and she's almost done with her nursing degree. So she is proof that people do go on to lead fulfilling lives with diabetes. It's important to understand that diabetes is not a death sentence or something that has to be a burden for the rest of your life. The first step in understanding this is educating yourself on the different types of diabetes. The second step is figuring out with your doctor which methods and medicines to take to combat diabetes with your body. The third step is making changes in your diet and exercise to give your body a better chance of fighting the disease. There are two different types of diabetes, and there's also a type of diabetes that occurs during pregnancy, and there's also a precursor. The important thing to know about all of these is that they all deal with the misuse or the lack of insulin in your body that's created by your pancreas. Insulin is a hormone needed to convert sugars, starches, and other food into energy needed for daily life. It also causes cells in the liver, muscle, and fat tissues to take up glucose from blood and convert it to glycogen and store it in the liver and muscles for later use. It also prevents the utilization of fat as an energy source. According to the CDC, over 79 million people, 35% of adults aged 20 and over, and 50% of adults 65 and older suffer from prediabetes. Out of all these 79 million people, only 7% are aware of their condition. Prediabetes is blood sugar levels that are higher than normal, yet not high enough to be diagnosed as full-blown diabetes. Symptoms include unusual thirst, frequent urination, blurred vision, extreme fatigue, frequent infections, cut and bruises that slowly heal, just to include a few. Symptoms can progress gradually, and most people may not even know if they have prediabetes, so it's important to go to your doctor and be checked if you think you might fall under the category. But also know with lifestyle changes to your diet and exercise, you can prevent the onset of type 2 diabetes, so it's very important to stay on top of this. Type 1 diabetes is an autoimmune disorder. It's when the immune system sees the pancreas as a foreign body and attacks it by mistake. This means that your pancreas no longer has the capability to produce insulin on its own. Therefore, you must take up where it left off and inject insulin to your body daily, or later on move to an insulin pump that does it for you. Also, exercise and diet is important in combating type 1 diabetes. Type 2 diabetes is when the pancreas produces very little insulin or cells ignore the insulin. But this is the most common type of diabetes, and millions of Americans suffer from it. Type 2 diabetes can run in families, but the exact nature of how it's inherited or the identity of a single genetic factor is not known. Gestational diabetes occurs during pregnancy, usually around the 24th week, and this doesn't mean that you've had diabetes before you conceive or that you will have it after you have the baby. Just follow your doctor's orders, and you should be able to have a healthy delivery, and it usually disappears after birth. Exercise is very important when you have diabetes because exercise has an insulin-like effect on glucose. It uses glucose as a fuel, so therefore it lowers the levels in your blood, which also will lower the insulin that you have to inject into your body. It is important to exercise 3 to 4 times a week at low to moderate intensity for 20 to 60 minutes. Aerobics are recommended, also flexibility exercises, strength training exercises, and resistance training exercises only 2 days a week for 20 to 60 minutes. A healthy diabetes diet is a very important factor also when you're trying to have a healthy life with diabetes. Remember that alcohol is very similar to fat in the processing and calorie intake. Choose foods high in fiber like whole grain, breads, fruit, cereal. Eat the right amount of calories to maintain a healthy weight. Do not skip meals. Eat meals and snacks at regular times every day. So you see now that there is some hard work in leading a life of diabetes, but it can be done. And also the things that you need to do will also help you lead a healthier life if you do not have diabetes. So it's honestly just a lifestyle choice that you make. So people do have healthy lives when they have diabetes.
Okay.
Good.
Good.